Asthma is an obstructive respiratory disorder. Airway is narrowed because of smooth muscle contraction. Asthma shows increased mucus production, edema due to vasodilation of the bronchial vasculature, and increased parasympathetic reflex. Patient's respiratory system is super responsive in response to certain triggers, such as allergens, flower pollen, house dust, animal hair. Also exercise, cold air, irritants. Certain drugs such as aspirin or NSAID can contribute to asthma. In the bronchioles, inflammation, increased mucus secretion, and smooth muscle constriction are observed. These factors contribute to a narrowing of the airways and an increase in the resistance to air moving in the airway. For asthma symptoms, we can check out shortness of breath. It makes patients to breathe faster and harder. Dyspnea, which is difficulty with breathing, discomfort, regular disturbed respiratory cycles. We can check wheezing, chronic cough, and chest tightness in asthma patients. For the physiology, for acute asthma, the allergens such as flower pollen or animal dust triggers allergic response, increasing the amounts of IgE in the airways. These IgE are going to attach it to resident mast cells. These mast cells trigger degranulation and release a lot of prostaglandins and leukotrienes. Prostaglandin, leukotrienes induce bronchospasm within seconds. Mucus secretion and edema will occur within minutes to few hours. For the treatment, we use beta-2 agonist. Short-acting beta-2 agonist is sometimes called SABA, is a standard reliever therapy that should be first line for most of asthma patients, such as Ventolin, salbutamol. SABA mimics adrenaline characteristic, and when beta-2 adrenal receptor is activated, it reduces the intercellular calcium concentration in the smooth muscle cell. Bronchodilator that relaxes the smooth muscle in the airways, which allow air to flow in and out of the lungs more easily, and therefore it is easier to breathe. Beta-2 adrenal receptor agonist also increases mucus clearance by increasing ciliary beat frequency, decreasing microvascular leakage, and inhibit release of chemicals from mast cells and neutrophils. SABA, beta-2 agonist, Ventolin salbutamol is the first line. Also, we use corticosteroid such as fluticasone. This works by decreasing the irritation and swelling in the airways to allow for easier breathing. Asthma, obstructive respiratory disorder.